Hey, hi everyone. Welcome to our session today. Hopefully everyone can see these slides. Okay, so we'll go ahead and get started. So thank you everyone for joining the Business Operations Educational Conference as part of the 2021 Virtual Southeast Regional Fruit and Vegetable Conference. My name is Christina Meza, and I am a CSTE Epidemiology Fellow with the Georgia Department of Public Health, and I will be moderating this presentation. So just remember that we will be answering your questions live at the end of the presentation. So you can go ahead and at any point throughout the presentation by typing them in the question box, or you can save them towards the end. But don't forget to press send so to make sure your question goes through. And we want to make sure not to forget to thank our 2021 conference sponsors and exhibitors. And you could do so by visiting the virtual trade show and the featured products pavilion. And of course, we don't want to forget to make sure that everyone joins us for the morning coffee chats. Those begin at 8:15, and then the evening receptions and networking, which begin at 5. So you can check the conference agenda for those details as well. And now I would like to introduce our speaker for today, Amanda Feldpausch, who is a senior epidemiologist consultant with Georgia Department of Public Health. And she will be presenting on COVID-19 agriculture and public health preparedness. Amanda has been a huge partner in helping manage COVID-19 hotspots within the industry, as well as create workable guidelines for Georgia's agricultural workforce. She will be giving an overview of current Georgia Department of Public Health guidance for agricultural employees, as well as review several tools created in collaboration with industry partners, such as GFVGA, UGA, and Georgia Department of Agriculture. Now, before we begin the presentation, as we all know, we have been inundated by information surrounding COVID-19, whether that be from media or other sources. And in that same vein, public health is continuously learning new things about COVID-19 every single day, just as science learns more and as guidance improves. So because of this, guidance is ever changing and continuously improving. And it is our hope that this presentation will provide a simple yet digestible overview of the preparedness, guidance, and public health response overall within the agriculture industry. And remember to get your questions ready for the end of the presentation. And without further ado, I will go ahead and let Amanda begin her presentation and switch to her slides. And Amanda, you can go ahead whenever you're ready.
Thank you so much, Christina. And I have to share that the theme of this talk really will be collaboration. And Christina has been an incredible part of our collaboration as well. So Christina works with myself as well as our state public health veterinarian on the agriculture response for COVID-19. So it's really a big group project, basically. And it's been incredible to work with all of our partners, not only in industry as well as Department of Ag and university partners, as Christina mentioned, but also with people like Christina, who is a new fellow in our organization, and we're excited to have her on board as well. So as Christina said, I'm going to talk a little bit about COVID-19 agriculture and public health preparedness. As Christina already alluded to, our response is guided by the science, which for this novel virus, we learn more every day. And as you all know, guidance has changed significantly over time. Even as recently as the last couple of months, we've seen changes in our contact and quarantine guidances from a national level all the way down to state level. So what I'm going to talk about today, the slides will be pretty 10,000-foot view, as we say, but we'll talk a little bit about specifics in Georgia. You'll hear me say it throughout the presentation, but I encourage you to contact your local public health departments as well as state. So if you're not in Georgia, your state public health department there. And even if you are in Georgia, your local public health departments. There are resources that may be specific to your area. And it's really important to establish those communications and collaborations early before you even need them. So we'll keep talking a lot about collaboration throughout this, but I just want to make a plug for that right off the bat. So the overarching goal for today is, again, to talk through prevention measures and assessments that are relevant to fruit and vegetable growers. And we are going to talk about some tools that have been developed in conjunction with our partners at Georgia Fruit and Vegetable Growers Association, Department of Ag, university partners, as well as other community partners. This is actually the cover of the Georgia booklet for COVID-19 Farmworker Health. This is one of the first evidence of collaboration. We actually adapted this from a booklet created by the Connecticut River Valley Farmworker Health Program. And again, really want to highlight throughout our discussion today that responding to COVID-19 could absolutely not be done without collaboration. And we found the more that we open our minds to people's expertise, the more rewarding it has been. And our guidances and response have benefited significantly from it. And it's allowed a head start in so many ways. So this is a great example here, again, that the Connecticut River Valley Farmworker Health Program developed this booklet. And although we added some pages and adapted it to be specific to Georgia's guidance, the foundation of the booklet was really such a head start on the entire project. And that was due to the work that Connecticut River Valley Farmworker Health Program had done on this. So the first thing we start with is the first page of the book. So what do we know about coronaviruses? This is just a little bit of background. I know that pretty much everybody has become more knowledgeable about viruses than we ever thought would be necessary in our lives. But we always like to touch on the basics of the overarching things that have brought us to where we are now. So coronaviruses are a large family of viruses. Some cause illness in people and others only in animals. Some coronaviruses you may have remembered hearing about at the beginning of this response, and maybe still, is Middle Eastern Respiratory Syndrome and Severe Acute Respiratory Syndrome, so MERS and SARS. Those were big in the media several years ago and were a concern kind of at the beginning of the COVID-19 response. The new novel virus, as you all know, is known as COVID-19. It's important to remember that there are actually 4 coronaviruses that circulate in the US and have for many years that just cause something similar to a seasonal flu. And that's something that people are still particularly may be able to get right now. So although COVID-19 is on the forefront of everybody's mind, there are other respiratory illnesses that we have to be concerned about. So we always plug here, don't forget your flu shot. The flu is obviously something that circulates in the US every year, and getting your flu shot can help to prevent getting the flu. And as you know, the signs of flu are similar to COVID-19. So it can help to prevent you from getting the flu, which could be convoluted with symptoms of COVID-19. But also we have seen people who are co-infected, so they have the flu and COVID-19. And as everyone knows, with COVID-19 as a virus, we want to make sure that people are as healthy as possible. So having 2 viruses at the same time is not ideal. So if we can at all avoid that, that is most ideal. So please don't forget to get your flu shots if you haven't already this season. In the booklet here to the left, we talk a little bit, and I want to preface, I realize that the text in the booklet pages is probably very small. The booklet is available on our website, and I'll touch on a few of the kind of overarching points within the booklet, but the booklet is available to review specifically if you would like. So here in the booklet, we talk a little bit about the background of coronavirus, COVID-19, and how it spread. We also set up our flow through the booklet of layered prevention measures. As you all have seen, there's a lot of science out there about the effectiveness of different measures. So wearing face coverings, social distancing, washing hands, things like that. But I think the thing we all can agree on is doing just one thing is not enough. So one of the things we really focus on in Georgia is layered prevention measures. So wearing a face covering, but also social distancing. Each is not a substitute for the other. We'll talk a little bit more about it later, but it's just like hand sanitizer is great, but is not a substitute for washing your hands. So we want to keep those layered prevention measures and to be thinking about using multiple ways to prevent coronavirus and COVID-19 within our populations. So that brings us to what we really encourage everyone to do, which is to have a plan. Layered prevention measures can be difficult to think about in the moment when you really need them. So if you have an employee that is sick, or you have someone who may have been exposed to COVID-19, it's much easier to think about how to implement those ahead of time before you need to be doing it for someone who is sick. So again, layered prevention measures are important to do before anyone is sick to prevent additional spread if someone does come to work sick. So here we have a screenshot of a checklist that we adapted in Georgia from CDC guidance. Again, this is another example of collaboration. Although the CDC checklist didn't meet our exact needs, we were able to adapt it for use in Georgia, and that could not have been done alone. So this was something else that we worked with Georgia Fruit and Vegetable Growers Association, Department of Ag, and university partners on to make sure that this was implementable in our agricultural populations. So again, even if guidance isn't perfectly useful or perfectly suited, it can always be adapted for the specific situation, and we want to encourage that collaboration. So the things that we want to think about here with your plan is the number one priority is the health and safety of our people. So business continuity is certainly important, but that obviously comes second to the health and safety of the people who work for you. That said, having a plan in place will help to protect people and at the same time continuity of business. Some of the resources that may be helpful for those of you in Georgia is the Georgia Department of Public Health checklist and other collaborative resources. The CDC also has an agriculture employer and employee checklist and webpage. And then Department of Ag and industry partners like Georgia Fruit and Vegetable Association, regardless of the state that you're in, you should be able to find resources with your state public health and local public health department, as well as community partners. And again, CDC federal guidance is available statewide, or excuse me, countrywide. So we're going to talk a little bit about the sections of the checklist because it's a good way to kind of go through what we think about in a plan for prevention of COVID-19. So some of the things we're going to talk about is the assessment, screening and monitoring of workers, layered preventions, which include all of those things listed here, which we will talk about individually, managing sick workers, which includes quarantine and isolation, which we'll talk a little bit about the difference between those two. And then managing stress is another thing that's really important in this response that often gets forgotten in the hubbub of everything else. So for the assessment, again, we want to encourage thinking ahead before there are sick employees or before you may have a COVID-19 case within your population, worker population. So we encourage getting in touch with local partners ahead of time. We often get asked in these talks, like, well, what do I say if I don't have anyone who is sick? You know, what is my reason for reaching out to local public health or any other organization? And really, it's just to create those lines of communication. So reaching out and saying, hey, you know, I am an employer at this farm and I have 275 or 300 farm workers that come in, or even if it's as little as just a handful, just letting them know who you are can be helpful in the future if they have questions, if they have resources that come in from the state for farm workers or for growers or agriculture, they'll know who to reach out to. And when and if something happens, they'll immediately have a contact. And that happens to us quite often at the state. We'll remember someone we talked to a year ago about something else and say, oh, well, I know I can reach out to that person. So, you know, even just a touch point can really help to create those lines of communication so that you have them when needed. And also when you're reaching out to local public health departments, sometimes the first person you email off of their website or the first number you call may not be the best contact for agriculture or for COVID-19. And so going ahead and reaching out ahead of time and figuring out who that contact is can save you time when you're in a more immediate situation and you want to talk to somebody. So we also encourage people to provide information to their employees from reliable and up-to-date sources. So Christina mentioned it earlier that there can be a lot of conflicting information from the media and other, you know, web pages that are maybe not as reliable as places like CDC or your state public health department, your state agriculture department, or your industry partners who are working in collaboration with public health. So make sure to, provide that information to your employees. We also recommend designating a workplace coordinator for COVID-19. This doesn't need to be anything super formal, but just having someone who you can look to disseminate information, to make sure that all of your employees are receiving that information, and that they are able to report things to you if people have questions or concerns. Just having someone who is a point person can be really helpful in communicating with those that work for you. And then again, contact local public health about questions you have ahead of time. So here in Georgia, we've been able to coordinate mass testing for some of our agricultural partners. And some of the things that have really helped with that is having communication with us ahead of time. It's not required, but as I talked about earlier, having those communications ahead of time just established existing communication lines, which were easy to then utilize when the need for testing arose. So the next thing that we talk about with our assessment is also your ability to practice layered protection. So in your assessment, we want to make sure that people are encouraging and also making sure that using face coverings is an easy choice. So providing cloth or paper masks, and also understanding what fit testing is and the feasibility of that. So what is recommended is that everyone wear a cloth face covering or a face mask. CDC does recommend cloth face coverings as they are washable and reusable, and they don't take masks away from our healthcare providers. But there are options for paper masks as well. It's important to know the process for using these. So again, cloth masks should be washed regularly and kept clean. They should only be used by one person, things like that. Paper masks should be replaced every day. And even within the same day, they should be replaced if they become soiled or difficult to breathe through. We often see people who talk about utilizing N95 masks, but those are only really usable if a person is fit tested for them. Fit testing may not be feasible for your workforce, and that's completely understandable. But it's just one of those things where if people are trying to purchase N95s, they should only be doing that for people who are fit tested. If your workforce is not fit tested, then the N95 is not really any more helpful or protective than a cloth or paper mask. So it's much easier to access those other types of masks and may encourage people to use them more because they're an easy choice. They're there and they're easy to provide to your workers. And this is another page from our book about wearing a face covering or mask. And again, it mostly just outlines how you should wear them. They should be close fitting to the face, and they should be washed and kept clean. And it also talks about not touching your face or spreading germs while you remove and replace the masks each day. So another layered protection every day that we want people to consider in their assessment of their own workplace is social distancing. So distancing versus masks, there's an exposure consideration here. A lot of people get confused and think that if you're both wearing a mask and one of you becomes ill, then you wouldn't be considered exposed even if you were within 6 feet of each other. The fact is that if you are wearing a face covering and you are not fit tested, you are not wearing full PPE, even if you are wearing a mask, if you are within 6 feet of someone who tests positive for COVID-19 for more than 15 minutes, you're still considered exposed. Sometimes we get the question here of, well, then why wear masks at all? And the answer there is that it still reduces your risk significantly. There was a paper that came out from CDC concerning some hairstylists that worked in a salon they had a very strict mask policy for themselves as well as their clients. They ended up testing positive, those who were actual hairstylists. And they saw over 160 clients. Everyone wore masks, and not one of the clients became ill with COVID-19. You would still be considered exposed for quarantine purposes, and that is on the chance that you become positive. We want to try to prevent additional spread. But for your own personal health, if you're wearing that mask, it's much less likely that you will actually become positive with COVID-19 from that exposure to another person who is also wearing a mask. In addition to that, distancing is really important. So we talked about this earlier, but one layered prevention does not replace another. So wearing masks as well as social distancing is really important. And where this comes into play for your assessment or for employees is, thinking about this ahead of time. So determine a recognizable comparison for 6 feet. I know for a lot of people, including myself, at the beginning of this response, being able to visualize 6 feet is not always immediate or inherent. So we always recommend to choose something that your employees know. For farm workers, some of the things that we came up with is it's about the length of 2 blueberry bushes. It's also every other row for a lot of agriculture situations. And also the front of a 15-passenger van is just slightly over 6 feet wide. So these are just things that people might recognize. They might be able to look at a distance and say, oh, I know how far that is. And so in my mind, I can keep that in mind. We encourage that social distancing is practiced at work. So that's something to consider when you are thinking about tasks that are done and how social distancing might be encouraged. We do know that there are places within facilities, especially when you're talking about packing lines where 6 feet may not be possible for people to be apart. And this is where we encourage those creative layered protections, and partitions are one thing we've seen people do. Those can be made out of plexiglass and specific for your line, or they can just be a curtain that you put up. Anything that creates an additional barrier, masks, distancing, partitions, any of those will add another layered prevention. And again, ultimately what we're doing is trying to prevent the spread of COVID-19. So those can be really helpful, and we encourage people to get creative with those things. So one of the last things, or one of the last few things we talk about with layered preventions every day is washing hands. So we talked about this a little bit earlier, but education is almost as important as adding hand washing stations. You can add all the hand washing stations in the world, but if you don't give people information about how they should wash their hands, then it may not do anything. So we always encourage some education about hand washing. It should be washing their hands for at least 20 seconds. So one way that you can count to that is to sing happy birthday in your head for 2 times through, which is approximately 20 seconds. So, if you wash your hands and then you wipe them on your clothes, or you wipe them on a dirty towel that everyone is sharing, that can really take away the benefits of the actual hand washing. So again, this is where that education comes into play, is to remind people of those important factors that are easy to forget. If you wash your hands and you immediately touch your face, then your hand, is contaminated again. So trying to preserve those benefits of hand washing by providing education about what people should do after washing their hands can be very helpful. And then although hand sanitizer is really important, we always want to stress that it's not a replacement for hand washing. When you use hand sanitizer, if you have dirt and debris on your hands, it can only get rid of so much. So we do encourage people to provide hand sanitizer for between hand washing, or when hand washing is just not possible. But it's important, again, to remember that it's not a replacement for hand washing. So then our last everyday layered protection is cleaning and sanitizing. So here's another picture or page from our booklet about cleaning and sanitizing. It's something we don't have to tell food safety people about, which I know we have some people from food safety attending here. But we recommend keeping up with current EPA guidelines and cleaners that are effective against COVID-19. If you have people living on site, make sure they're educated and aware of cleaning and sanitizing guidelines. So this is something you can share, again, with that workplace coordinator, going back to that recommendation. If you have a workplace coordinator who can share that information with people, maybe a point person in each of the barracks or in the living situation that you're in. If you have workers who are staying at a hotel, talking with the ownership there about their cleaning and sanitizing practices to make sure that they are in line with what you would want for your workers. Those are all important conversations to have. Here in our booklet, we talk a little bit about the things that we encourage people to think about cleaning and sanitizing. So cell phones, it's something that people often share and don't really think about, but cleaning and sanitizing those, especially if you share them with others, are really important. For farm workers specifically, tools and equipment that are shared amongst workers, making sure those are cleaned between workers and also regularly, even if they aren't used by very many people. Frequently touched surfaces. So again, even if you don't have people living on site, within your facility, there are likely frequently touched surfaces like light switches, desks when you walk in, chairs that people sit in the breakout rooms or where people eat. Even if you have them eating in shifts or spacing out, there still may be people using the same chair, multiple people using the same chair over and over again. So thinking about those frequently touched surfaces and cleaning and sanitizing them often. If you have people living within your facility, so again, barracks, remote controls for the televisions, furniture, again, that's shared, and then bathrooms, of course, that would be with any facility. There are frequently touched surfaces in there. When you're talking about turning on the water to wash their hands, most people will turn on the water prior to washing their hands. So that can be a really, dirty surface or a frequently high touch surface that would need to be cleaned. We also, in our booklet, have some examples of cleaning products that can be used. But again, we tried to stay pretty high level so that we could reference back to the EPA site for up-to-date information on contact times, as well as different cleaners that are recommended for COVID-19. So the next couple of slides are specific layered protections that may only be relevant to people who have workers who live on site. That said, though, it's still information that can be shared with your workforce, even if you don't provide housing. What we've learned from our industries that we work with is that often, even if they don't provide housing on site, they have a lot of workers who are part of the same family or live in other types of congregate settings. And so providing this information to them can help to prevent COVID-19 in your facility by helping them to prevent it at home. So if you do provide housing, though, whether it's on-site, hotels, or in other group housing, we encourage people to be aware of who's in their cohort. So if you put in all these prevention measures at work, but then people go home and they congregate without, masks or social distancing or anything like that, they have exposures to each other that even though you're preventing them in the workplace, they're occurring in the evening or when they're at home. So encourage people to be aware of who is in their cohort. This can help if, for example, you had a positive, then they would be able to identify others who may be at risk. But it also helps you in cohorting people to work together who may be exposed to one another. So we also want to think about ways to encourage layered protections that are realistic for your employees at home. So some of the things we have in our Engage in Safe Housing page here is sleeping head to toe. So if you have a barrack situation, if you have people arrange their beds to where it's head to toe, that just puts additional distance between respiratory areas, so nose and mouth. We also encourage, again, those creative partitions. So putting a curtain, shower curtain, hanging a sheet, any kind of creative partition between beds, again, can reduce the amount of exposure people have to one another at night when they're sleeping. We also encourage, if you're thinking about after work activities that people participate in. So we know cooking and eating together, hanging out, playing games, things like that, obviously are going to be something people want to do and enjoy. And there are ways you can encourage that being done safely. You can set up areas where chairs and other seating arrangements are spaced out already 6 feet apart, so that people don't have to do that guesswork for themselves. And also, encouraging people to think about it overall is also important. So if you have people, for example, staying in hotels, sometimes people don't think about the pool or the gym or other areas where they might be engaging in activities where exposures could occur. So encouraging them to be aware of mask wearing and social distancing in all situations, not just at work, can again help to protect your people in your office and also your business continuity. And then the second one that is again specific to employers that provide any sort of group transportation, but again, is still good information to provide to your employees, since they may take public transportation or they may travel together to work. And again, their exposures outside of work impact them. And, they may still contract COVID-19 if they're not practicing safe layered protections outside of work. So if you provide any group transportation, or if workers commute together, it's really helpful to provide information about engaging in safe transportation. So some things that they can do if it's a large enough vehicle is staggering seats. So you can see here in our page for engage in safe transportation, the aerial view of the bus. You can see the recommendation to stagger or zigzag people down the row. We also encourage wearing masks, of course, in vehicles. Another thing is, if the weather permits, you can keep windows open to encourage fresh airflow. And we also recommend, again, riding with the same coworkers every day. And this just prevents additional exposures to multiple people. This is another opportunity, if you do provide housing and you do provide transportation, to cohort workers. So encouraging people who live together to ride together, things like that, because it limits their exposure to multiple groups. So the next thing we wanted to talk about, after assessing your facility, what your capabilities are, assessing your plan, and assessing your layered preventions that you encourage amongst your workers, is screening and monitoring workers. So you can do all the things we already talked about to help prevent COVID-19, but it could still occur. And so screening and monitoring workers is really important. So we recommend developing a plan for screening and monitoring your workers for illness. And the biggest thing here is to be prepared with a plan for what to do if one of them has a fever or reports symptoms. Even if it doesn't turn out to be COVID-19, there will be someone, I'm sure most of you have already experienced this, but if you haven't already, there will be someone who has a fever or reports some sort of symptoms. And it's really important to have a plan in place for what to do if you have a worker that shows up at work and reports those things. How will you isolate them? How will you protect others from, being exposed to them, if at all possible, who have not already been exposed? How will you help them to seek medical care if needed? How will you help them seek a test if needed? This is another opportunity where, if you have reached out and established relationships with your local public health department, you may already be aware of where testing opportunities are, which will help to cut down on that time that this worker may be, waiting to know, and how long you may be waiting to know if you had someone with COVID-19 in your facility. We also really want to encourage people to report immediately if they have symptoms. As a lot of you all know, the time of which someone is infectious includes 48 hours prior to symptom onset. So if people report symptoms as soon as they have them, you're helping to reduce the number of days that others may be considered exposed to them or may have been exposed to them. So encouraging people to report symptoms early can help to prevent further spread within your worker population. Again, protecting your employees and your workers as well as your continuity of business. Again, we want to promote mask wearing and other layered protections. And one of the reasons for this is all the things we've talked about before. But if you have a worker show up who does report fever or symptoms, again, if everyone around that person is wearing a mask, social distancing as best as they can, and practicing other layered protections, it will reduce the chance of one of your other workers becoming sick from that exposure. Again, these things work only if you're doing them ahead of time. So if you identify someone who is sick, it's too late to start, wearing masks, social distancing, practicing layered protections. Those need to be done up front to really reap the benefit of them. And the other thing is to know the legal requirements for workers who are sick or who have been exposed to someone who is sick and plan ahead of time for those. And we're going to talk a little bit more about that in this a little bit later. And what I'm really referring to here is your state's requirements for isolation and quarantine for people who have tested positive for COVID-19 or who are believed to be infected with COVID-19 versus those who may have been exposed to someone who has COVID-19. So the things to monitor for, the symptoms are broad. So we have here on one of our pages in the booklet, what are the symptoms of COVID-19? Some of the classic ones we think about are fever, loss of taste or smell is one that's been, really noticed recently or documented recently in cases. Cough and other respiratory symptoms, sore throat. But we've also documented people that only have gastrointestinal symptoms, and that's their only symptom of COVID-19. So we really encourage you to be thinking about any symptoms of illness. We also use the phrase, when you hear hoofbeats, think horses, not zebras. We also want to think about and not forget about other illnesses that may occur. So again, flu or norovirus, other gastrointestinal illnesses that may be infectious to other workers. So keeping up with symptoms and making sure that people are not coming to work sick, and again, encouraging people to report early will not only help to protect your workers against COVID-19, but also other infectious diseases that might cause them illness and discomfort. So again, symptoms are often not present even in a person who may be infected. And so this is why layered protections are key to prevention. So again, going back to what we talked about on the previous slide, wearing masks consistently and correctly, social distancing as much as possible, washing hands, cleaning and sanitizing, and practicing safe transportation and housing will help to prevent spread, even if there is someone who is positive who is not showing symptoms. We talked earlier about how wearing masks and social distancing is not perfect, but it does significantly reduce the risk of someone getting COVID-19 from someone else that they're around. So since we know that there are asymptomatic infections or infections in persons who do not show symptoms, those layer protections are, again, a key to preventing spread. And then the other thing is we know there's also some complications in monitoring surrounding people with chronic illness. So one of the things that we get asked a lot is, well, I have a worker who has COPD or who has known asthma. And, what if they report cough? So what we really talk about here is encouraging people, again, to feel comfortable being honest. If this is just a normal asthma experience that they have, nothing has changed, they don't have, fever associated with it, it's a cough they've had for weeks, months, and it's exactly the same. What we're really looking for in those persons are something that is a change or worsening. And again, this comes down to education for your employees and making sure they feel confident and comfortable telling you if they don't feel well. So the next thing we'll talk about is what to do with a sick worker. So you are practicing layered prevention measures in your facility. You've done an assessment. You're monitoring for sickness every day. You're encouraging your workers to report in a timely manner. And so then it's, what do you do if someone does actually report being ill? And that goes back to what we talked about earlier. Having a plan in place in advance will be critical. Know what the requirements are for isolation and quarantine, which we'll talk about in just a couple of slides. And also know where you can take someone if they're very sick. Again, making those communications and collaborations with local public health early, knowing where you can get tested. In Georgia, we have a COVID-19 testing page on our main DPH website where you can get the phone numbers as well as the link for signing up for testing in your specific county. We have testing opportunities in all 159 counties that are associated with DPH. But in addition to that, there is testing in a lot of local places for free at places like CVS or Walgreens, and even some local health facilities. So being aware of what's available in your area will help you to have a plan for a sick worker in advance. For this page in our booklet, we have different things available for those who may have people staying on site. So isolating that worker, if they live on site, if you do provide housing, it's important to have a plan ahead of time of how to isolate a sick worker, how to have them stay and sleep away from others so that they're not continuously exposed. Making sure to encourage those additional layered preventions of mask wearing and social distancing, making sure to clean appropriately after them, and making sure that they, as they are sick, still continue to do things like washing their hands, wearing a mask, social distancing from others, and being aware of those things. COVID-19, rarely, it does, as we all know, it does happen where it has severe outcomes. But being aware of that, most people are able to recover at home, but make sure to call 911 if you ever feel that someone's having a medical emergency. So keeping all of those things in mind. So a quick note on testing. I know I've mentioned it a couple of times, but have a plan for testing before you need it. In Georgia, your local health department will test you or your workers for free. They don't need to have an identification card, but you should make an appointment. So you can, again, find phone numbers or instructions for scheduling online at our COVID testing site. If you are not in Georgia, check with your state or local health department for links. Again, even in Georgia, this is our statewide testing email, but if you make contact with your local health department, they may provide you with additional information for local testing options. Again, there may be pharmacy or drive-through testing sites in your area. Make sure to ask about cost before making an appointment, but some of those are free. And then we always want to touch on this, but using a test-based strategy for prevention is not recommended. Testing is an important part of the overall plan when you have sick workers or you have another reason to test someone, as we'll talk about later with quarantine. But testing negative does not clear a person for work. It just means that they were negative on that test at that time. They could be infected and be too early in their illness to be shedding enough virus to be detected. Also, some types of tests are more accurate than others. There are false negatives. So we do encourage using tests in appropriate situations. So again, when you have a sick worker, or if you have a worker, we'll talk about it with quarantine, that qualifies for testing. But we really want to encourage not using it as a get out of prevention measure free card. Testing is important as a part of an overall plan that includes layered preventions like mask wearing and social distancing. So now we're going to talk just a little bit about quarantine versus isolation. So you probably hear these words quite a bit in media and in other areas. And quarantine and isolation are two terms in public health that are used for different situations. Quarantine is something that keeps someone who might have been exposed to a virus away from others. So the people who undergo quarantine are those who have had a known exposure to COVID-19, but who do not currently have symptoms and have not currently tested positive for the virus. The reason I say currently is because, as you guys know, we're at a point in this COVID-19 pandemic where someone may have had COVID-19 a few months ago. So someone who has a known exposure to COVID-19, but has not had COVID-19 in the last 3 months does need to quarantine. Again, they also need to not have symptoms of the virus. Isolation separates someone who is infected or thought to be infected with the virus from others. So people who undergo isolation are those who have tested positive for COVID-19 currently, or who are suspected to be currently infected with COVID-19. So this is an important time to point out that you should check with your state and your state guidance for those who have symptoms but have not been tested. In Georgia, we ask that people who have symptoms consistent with COVID-19 but who have not been tested yet, we ask them to isolate until they can be tested, because, if they have COVID-19, just because they don't have a test yet doesn't mean that they're not a risk to others. So check with your state on the specific guidelines for people who have symptoms but who do not have a test result. So that's the difference between quarantine and isolation. So again, quarantine is for those who may have been exposed. Isolation is for those who are positive for COVID-19 or who are thought to be currently infected. So for quarantine, these are, again, for people who are exposed as a close contact. So how long does quarantine last? And this is a place where we didn't put in current guidelines because at the time that I was putting this presentation was when CDC was able to recently update quarantine guidelines. So we encourage you to check with your local states as well as CDC for current quarantine guidelines. Right now for quarantine, there are a few options. So 14 days is the gold standard for quarantine. The incubation period for COVID-19 can be anywhere between 2 and 14 days, but on average, it is typically between 5 and 7 days. For that reason, a couple of options have been added, which Georgia does offer. So a person can be tested as long as it is on day 5 or later for COVID-19. And if negative on that test, you have to receive the result back. They can leave quarantine after day 7. So there is science online that you can see from CDC that illustrates the risk. The risk of developing COVID after that negative test is low. It still is present. It is possible for someone to test negative on day 5, for example, and then to develop symptoms on day 10. So that is still a possibility, though the science shows us that the risk is low enough that if you have a negative test on day 7, you can leave quarantine at that time. However, once you leave quarantine, you still need to practice enhanced prevention measures for the duration of your entire 14 days. So being especially cognizant of keeping social distance from others and making sure to wear a mask consistently and correctly at all times. And then of course, if you do develop symptoms, then you need to be tested and to isolate yourself. There are some exceptions for essential workers, which we'll talk about next. And we'll also talk about how important it is to consider these exemptions. For isolation, if you are infected with COVID-19 or believe that you are, that isolation does last 10 days from your symptom onset or your positive COVID test if you are asymptomatic. That is if you no longer have a fever for at least 24 hours without the use of fever-reducing medications, and any symptoms you have improved. If you are asymptomatic, it's just 10 days from your positive test. There are a very small number of people who may be extremely ill or who are immunocompromised, for which a longer isolation period is recommended, but that's a decision with an infectious disease provider and not a specific amount of days. So Homeland Security has a list of essential workers, which most states follow, including Georgia. There are some exceptions to the essential worker list in Georgia, but no exceptions to agriculture at this time. So agricultural workers are considered essential workers in Georgia. Make sure to check in your state if there are any exceptions to their essential worker list from Homeland Security. I don't believe that most states have any exceptions for agriculture workers, but it's always smart to check. So for essential workers, they are not exempt from isolation. So if you have a worker who is positive for COVID-19 or suspected to have COVID-19, they must isolate. So that's an important distinction. However, some essential workers may be exempt from aspects of quarantine. So again, quarantine is for people who have been exposed to COVID-19, but are not thought to be currently infected. Georgia DPH follows the CDC guidance, which allows essential workers to continue work after exposure if the business continuity cannot be maintained without them. However, there are additional recommendations for precautions. And one of the important things to point out here is, although there is the ability to do this, we really encourage having a plan in place, if at all possible, to allow workers to quarantine if exposed. Because even if they, are allowed to work, they still represent an increased risk to other people in your facility because you know that they've been exposed to COVID-19. So if they go on to develop COVID-19, you may have other people who are exposed within your facility. So if you can allow workers to quarantine for their allowed period, that can help. So again, this is just reiterating what I just said. Making sure to implement precautions and practicing them consistently and correctly is more important than ever with someone who has been exposed to COVID-19. Again, if the person who is exposed becomes positive, the timeframe for contact tracing will be 48 hours prior to their symptom onset or positive test. So allowing them to work to perform critical functions is important, but they should also otherwise be quarantining at home. This is a big misconception, is that although essential workers do have some leeway with actually going to work, they should be going home and quarantining after work. They should not be going and doing social activities with other workers. They shouldn't be going to the store. They should only be going to work and going home, and the rest of the time they should be quarantining as normal. So in summary, for managing sick workers, make sure to have a plan for isolation and quarantine. So again, make sure to check with your state and local public health for their specific guidelines. Stay up to date with CDC's updates with quarantine and isolation. One thing to share here is that CDC, when new science comes out, CDC typically is the first to release it. States will typically update their guidance as quickly as possible to match CDC. So if you see guidance come out for CDC, that can give you a kind of picture into what will be coming from your state, typically within a couple of days at most. So keeping up with CDC's guidance can be very helpful, although, ultimately your state's guidance is the best thing to follow, state or local. Another way you can help with managing sick workers or just allowing isolation and quarantine to be done with minimal effects to your workers and business continuity is to cross-train employees ahead of time to allow for quarantine when possible. Again, this may reduce the number of additional exposures and required isolations if others become positive. And do not allow or encourage people to return to work until they have completed their isolation criteria. That's really important. So we just have another few slides to get through. So a few things we talk about is engineering controls. So we've already kind of touched on this. Be creative in ideas for barriers or social distancing. It's not one size fits all. So again, it doesn't have to be custom made partitions on your lines or, custom made seating or custom made this or that. It can be something that you just come up with that you have available. As long as it creates a barrier between workers and adds another layered protection. Again, provide training for COVID-19 that is easy to understand in preferred languages and is at appropriate literacy levels. This is, again, where that workplace coordinator can be really helpful because they can relay to you needs of your workers, as well as places where things are not being met. So if they feel like maybe they can relay to you if they feel like education is not sufficient, or if it's in a language that's not appropriate, or their cultural competencies aren't being met by the state or local public health guidance, they can relay that information to you. We also recommend reviewing leave and sick policies to plan ahead for quarantine and isolation so that employees aren't encouraged to work while they're sick. The other thing that we always, we don't want to forget about is coping with stress. These unique populations will have unique challenges. So, stress is something that is occurring with everyone. We see it, everyone has something different they're dealing with COVID. May it be increased, stress at work because you can't communicate with others. It may be because of things that are just changing within your worker population. But there are unique challenges for everyone. So sharing information ahead of time, this is the page from our book. It provides some numbers to local numbers in Georgia for stress that are free and accessible. But make sure you have something that you can share with your workers so that if they do feel stress or that they need someone to talk to, that information is available to them. So overall, what we talked about today is just preparing yourself, have a plan to continue your essential business function. Again, that plan includes layered protections to prevent the spread of COVID-19 should a worker become sick with it, either with symptoms or with not. Having a plan for what to do with a sick worker if that does occur. Cross-training personnel to perform essential functions so that work can continue if key staff members are absent. Assess those essential functions and the reliance that the community has on your services or products. For agriculture, we know agriculture is essential. That is bottom line. It is absolutely essential. So, we know that you all need to be able to function despite this pandemic. So being prepared ahead of time will help you to do that. Again, encourage sick employees to stay home. This protects your other employees as well as your continuity of business. Reinforce those healthy behaviors, those layered preventions. Provide soap and water and also hand sanitizer, but again, remembering that it doesn't replace hand washing. And then again, monitor for and discourage stigma and discrimination surrounding COVID-19, and that goes back to that stress and coping with the things that come with COVID-19 in general. So our last thoughts are just to stay calm and be prepared. Reach out to your local public health and other health partners. Reach out to your industry partners like the Georgia Fruit and Vegetable Growers Association. Get your information from reliable and accurate sources. In Georgia, you can do that from the Georgia Department of Public Health or CDC, as well as Department of Agriculture, Georgia Fruit and Vegetable Growers Association. But again, prevention and not panic is important. If you're prepared ahead of time for these things, it can make it a lot less difficult to deal with. And that is all I have. So I will answer any questions if I can. And again, in the spirit of collaboration, if there's not one person who knows everything about this response. So if there's something I can't answer or something that you maybe want to do a little more looking into before you ask it, my email is here. Please feel free to email me and I can get a response back to you. So thank you everyone for your time.
Thank you, Amanda. Thank you, Amanda. I know that we have about 2 minutes left. And the next session is on time. So if you guys have questions, you can push them into the questions box and then don't forget to press send. And then if you guys are looking for pesticide credits, don't forget to sign out and in the chat box. So we'll stick around here for a few minutes after the presentation in case anyone has questions. But thank you everyone for attending. And if you have to go, we hope you have a good day.
Yeah. Yes, thank you so much. And again, please feel free to email if you want to go to the next session and don't have time to stay and ask questions.